So what happens in the spring? The vaccine's not ready yet. Government and health officials are working to make sure that they are ready for it when it does become available. WFMZ's Emma Wright has more now on what distribution may look like here in our area.
A COVID-19 vaccine is on the horizon, but the state says early distribution will be severely limited. Dr. Jahre, an infectious disease specialist at St. Luke's University Health Network, says when the vaccine does arrive, the first group of people it will be available to is healthcare workers and staff that have contact with the sickest COVID-19 patients, those who work in the ER, ICU, and on COVID patient floors. Next would be healthcare workers who do procedures that put them at high risk. Then healthcare workers and patients who are in high-risk areas like nursing homes.
We cannot require workers to get a vaccine that still has some unproven components, although we are very, very optimistic that it will meet the needs.
Vaccines would also be available for other essential emergency workers like firefighters and police officers.
We think that in several months, there will be what we call phase 2, where there's likely to be, in that situation, enough vaccine for other risk populations. For instance, people who are out there who have diabetes, high blood pressure, who are over the age of 65.
Jahre says eventually the vaccine will likely be available to the general public in places like doctors' offices and clinics. But the state may initially prioritize sending doses of the vaccine to areas that have the highest number of cases. Jahre says St. Luke's has applied to be among the facilities that will become vaccine distributors and has made arrangements to have the necessary equipment to do so. He says while initial vaccine distribution won't mean the end of mask wearing and social distancing, there is a light at the end of the tunnel.
The hope is that if we can get enough people to actually take the vaccine, that we could put a halt to the kind of pandemic that we're seeing right now. It remains to be seen whether that will actually come about and how many people in the population will actually take this vaccine and, of course, the long-term effectiveness.
Emma Wright, 69 News.